Hi, I'm Becca Whitson. I'm a fourth semester practical nursing student, and I'm doing an assignment on a toolbox activity. This toolbox will include 15 items that will be useful for me as a new grad. The first item I've decided to choose is a Bristol stool chart. It's going to be a laminated sheet. The reason why I decided to choose this is because as nurses, we are constantly assessing our patients, and this includes stool. Often stool can tell us a lot of things. If it's outside a type 4 or type 3, it can tell us whether our patient is constipated or possibly has diarrhea. If this is the case, it is our duty to report it and to give our patients the appropriate medications, also adjust their fluid to help them, because often when patients come in sick, this can be a secondary issue and it's not fun, and it helps our patients with the healing process if we can assess it and then change it. The next thing I've decided to do is a laminated mental status assessment card. This is important because every day we should be doing mental status assessments on our patients. Often our patients come into the hospital very acutely, and it changes a lot for them, and they could be going through a lot of stuff. Often our elderly patients can be going through a lot of depression, and I think it's important to monitor that and assess our patients based off of it so that we can get them further help, so they can have a positive experience throughout the healing process. The next item I have chosen is a ready-to-work bag, and this bag includes a stethoscope, a nursing watch, and it includes a blood pressure cuff. The reason I decided to do this is because these are 3 very essential items to have every day as a nurse. And if you have a bag with all 3 of them in it, and you have it at your front door and you're going to every shift, you won't forget it. I think it would be quite embarrassing if you forgot one of these things as a new grad nurse. They're essential for your job. They are used for patient assessments, patient vitals, which some patients, it can be done every 15 minutes. So it's very critical to have these things, and it's important to have a ready-to-work bag. The next thing I've decided to do is medication cards, and these are from pharmacology. And these include the usage, the functional classification, the dosages, the side effects, and also nursing assessments that have to be used for certain medications. So I have all these medications actually categorized in different piles, and some are for opioids, which there's very critical assessments to do with those. Some are based for mental health medications, some are OB medications, some are generic medical surgical. I have cue cards for cancer patients, as I am currently working on that floor and will be throughout my praxis. So I think it's very important to continue to do medication cards. What I tend to do is when I come across a new medication, I look it up in my textbook and I write a new card and I add it into whatever category it should go under. The next item I have decided to add in to my bag is actually a gym membership. So here it is. I think it's very essential for a nurse to have a gym membership, or make sure that they're at least getting their physical activity in. Being a nurse can add a lot of stress onto you, mentally, physically. You are moving patients a lot, so you're using your muscles, and I think it's important to keep in shape and keep up with your body and have time of your own to take care of yourself. The next item I've decided to add into my toolbox is a normal lab value sheet. So this includes something like this. So it's a laminated sheet that has all the normal values, and so that you'll know when looking at the values what is inside norms and what's outside. And then in the column here actually has like critical abnormal values. So when the values are at this state, you know that it's not good and that it should be reported right away if it's not already seen. I also, along with that, have a sheet of signs and symptoms of abnormal lab values, so you'll know if things are too high or too low. And it's just something to keep in my back pocket when doing assessments and stuff like that. Next thing on my list, I have a rapid head-to-toe assessment card. This includes every assessment for every part of the body. There's 2 sheets here. And it tells you what is normal, what is abnormal, and it's a great card to look back on and see what you've missed during assessments, what you could do further. Sometimes you come across different diagnoses that require different assessments, and you don't always do those assessments, so you can look back and be like, oh yeah, this is what I have to do. So I think it's a great card just to have as a reminder. It helps with documentation as well. The next thing I have in my toolbox is a nursing care plan online book. So, as a nursing student, I've had this going forward, but there's actually websites that provide this for you. So there's websites that provide nursing care plans, and it's like books and books and books. And you can go and look at different diagnoses and see your role as a nurse. So you can see the nursing diagnoses and then just go through are you worried about, what is your care for this patient. So here's just an example. This is a website. It's called nurseslabs.com. You can go check it out, and it has 500 plus nursing care plans. And I think it's an amazing tool to have, not only as a new grad student, but just as a nurse in general. The next item that I have added in is a math dosage formula cheat sheet. So it's for specifically medication administration. So here we have your dosage calculation, your IV drip rates, any IV calculations. It also has conversions on it. So it's just something to quickly look at. I think you'll constantly come across different calculations that you'll have to do as nursing when given medications. It's important to have that cheat sheet that can come right out instead of having to go look it up on the computer or something. You can also look at the back of your nursing drug reference book. There's also formulas back here that you can look back on. So if you bring this book every day to placement like I do, you can peek back there too to have a look if you somehow forgot my cheat card. And the next item I have decided to do is a cue card on the 10 rights of medication administration. It is very critical to do these 10 rights, especially as a new grad. You don't know your patients as well as some of the nurses that have been on the floor for quite a while. So I think it's important to always have a reminder of the 10 rights to giving medications. And you should be using these every single time. And here you can see it's just a little cheat sheet, and then you have all your rights on it, and you'll never forget. And it will stop you from making medication errors. So the next 5 items that I have in my toolbox relate to the C&O. So the first one I have decided to do, sorry, I'm just going back here. First item I've decided to do from this that relates to the C&O is a conceptual framework for organizing competencies as an RPM. So I will have a laminated sheet of this right here, as you can see. And I think this is very important to have because as a new grad nurse, you do not know sometimes what you are competent enough to do. You're just getting started, you're just doing new things. And so I think it's important to look at this chart and really assess where you're at. So it includes the inner of it has the client, the nurse, and the interprofessional healthcare team. So that's your first core. Then you have your assessment, your planning, your implementation, and your evaluation. Then on the outsides you have your professional responsibility, accountability, ethical practice, your self-regulation, and your service to the public. And then at the bottom you have your knowledge and knowledge application. I think this is a huge thing to look back to, and when you are not sure if you're competent, and have a step back and look at the resources that you have and understand where your competencies are at. The next thing I've decided to add in, so our 12th item, is I have my PPE stuff. So I have my gloves, I have hand sanitizer, and my PPE gown. I would also have a mask, and I think these are all important to add into my toolbox because preventing the infections is huge in the hospital. As a nurse, you're exposed to almost all of them, and you're going in multiple patients' rooms, and it's very critical for you to have a step back, make sure you're washing your hands, make sure you're doing your proper PPE to stop that to control the infection. And the 13th item I've decided to put in is a deciding to perform a procedure laminated sheet. So this is right here, as you can see. And it's another little thing to go through and see, are you competent enough to perform a procedure? So it goes through and it asks you different questions, and you ask yourself, yes or no, I can do this, or yes or no, I can't. If it's your first time doing procedure, obviously you're probably not competent enough to do that, and you should get somebody who has done it to show you, and then next time you do it and somebody assess you do it. As a new grad student, you're not going to know how to perform every procedure. There's constantly coming out with new procedures, and I think it's important to look back and see if you are able to perform it or not, and then take the opportunities to learn how to perform it. The next thing I've added, so item number 14, is cue cards on conflict management. So this is right out of the C&O as well. And I think it's important because as a new grad student, you're going to come into a lot of, I don't want to say the word drama, but there are a lot of conflicts within other nurses on floors, and you might be thrown right into the middle of it. And I think it's important to know your role within conflicts and how to manage it, and have the step forward on that so that you're not getting lost into conflicts as a new grad nurse. The last thing I've decided to put onto this is a cheat sheet on guiding decisions towards end of life. The reason why, so you can see on the C note, it's in here. The reason why I've decided to put this one in is because my practice right now is guided towards working with cancer patients and palliative patients. And for me, I could be stuck in many decisions towards end of life. The family gets involved, and it can become very confusing, and this is why I think it's critical to have my little cheat sheet about decisions at end of life, who has the decisions, what exactly end of life is, the end of life care, and it's actually all stated within the C&O. So I think it's important to have this within the field that I'm going in, especially as my practice, so I can look back and see what my role is and what the protocol is for end-of-life decisions. And that concludes my 15 items. A lot of my items I have sourced them around where I will be going for my practice, which is a cancer and palliative floor. And I've decided to basically just bring things that will help me become a more competent nurse on this floor. And I think these items will help me big time with when I forget something, I can just look back, or when my preceptor has a question, I can pull it out and I have it right there, and it looks good on me, it looks good to my preceptor, to the management on the floor. It shows that I'm prepared, and it's another aspect of my competencies. So, thank you.